Most men think erectile problems begin in the bedroom, but in reality, they often begin in the bloodstream. For millions of men, difficulty getting or keeping an erection is not just a sexual problem, it is a metabolic warning sign. And in many cases, it is the very first symptom of diabetes, appearing years before a blood sugar test ever reveals the truth. That's right, the body often whispers through sexual function long before it screams through medical complications. I'm Dr. Rena Loeb, Urologist, and today I want to explain the hidden link between diabetes and erectile dysfunction, a link so strong that many endocrinologists now say, if a man develops ED without explanation, test him for diabetes, even if he has no other symptoms. This relationship is not psychological. It is not about aging. It is not about masculinity. It is biology. And once you understand the mechanism, you'll never look at the problem the same way again. Let's start with the truth most men don't hear from doctors. An erection is not controlled by willpower or attraction or confidence. It is controlled by blood flow, more specifically, by the health of the blood vessels that carry blood into the penis. When those vessels are flexible, open, and responsive, erections occur naturally. When they are stiff, inflamed, and narrowed, erections become weaker, slower, or disappear entirely. And that is where diabetes enters the story, because diabetes is not just a sugar problem. It is a vascular disease, a disease of blood vessels. And the first vessels it destroys are the smallest ones, including the ones inside the penis. The artery that supplies the heart is about 3 millimeters wide. The artery that supplies the penis is only 1 millimeter wide. That means if plaque, inflammation, or sugar damage begins in the bloodstream, the penis is often the first place to show signs years before a heart attack, stroke, or kidney failure. That's why ED is now considered an early cardiovascular alarm. In many men, erectile dysfunction is not the problem. It is the symptom of the real problem: insulin resistance, prediabetes, or diabetes that has already started silently damaging the endothelium, the inner lining of blood vessels. When blood sugar stays high, it creates a process called glycation, which hardens and scars the blood vessels. This blocks nitric oxide, the molecule responsible for relaxing and dilating those vessels during arousal. Less nitric oxide means less blood flow. Less blood flow means weaker erections, slower response time, decreased firmness, or the inability to maintain an erection long enough for intercourse. And that is just the vascular side of diabetes. There is also the nerve side. High blood sugar damages the peripheral nerves, including the nerves responsible for sexual sensation and arousal. That's why men with diabetes often report not only performance issues, but also decreased sensitivity or delayed orgasm. It is not lack of desire, it is literal nerve injury. Now let's add the hormonal layer. Men with diabetes have a much higher chance of having low testosterone. Studies show that up to 40% of men with type 2 diabetes have clinically low testosterone, and in many cases, their doctors never test it. Low testosterone doesn't just reduce sexual desire. It reduces muscle mass, increases belly fat, disrupts sleep, weakens bones, raises inflammation, and worsens insulin resistance, creating a metabolic trap. Hormones, blood vessels, nerves all affected by the same root condition. So when a man says, "I'm having erection problems," the real question should be, what is this telling me about my metabolic health? Because erectile dysfunction is often the first visible clue of a disease process that is already affecting the entire body, from the pancreas to the heart to the kidneys to the brain. Harvard Medical School published research showing that men with ED are 50% more likely to develop heart disease, even if they have no known risk factors. The American Diabetes Association reports that men with diabetes are 3 times more likely to experience erectile dysfunction. And the Cleveland Clinic calls ED a vascular stress test that happens in your bedroom. So here is the uncomfortable but necessary truth. If a man over 40 suddenly develops erectile problems, and there is no obvious psychological cause, no new medication, no prostate surgery, no trauma, no severe stress, then diabetes or prediabetes should be investigated immediately. Because by the time sexual symptoms appear, blood sugar damage has already been happening for years. Now let's talk about what men feel, or rather, what they don't feel. High blood sugar doesn't cause pain. Blood vessel damage doesn't cause pain. Endothelial dysfunction doesn't cause pain. Diabetes advances silently until the symptoms become impossible to ignore. But erectile dysfunction is the early symptom, if men choose to listen. And this is why ignoring ED is so dangerous. Not because it affects confidence, not because it affects relationships, but because it gives the false illusion that the problem is sexual when the real threat is systemic. The penis is warning you long before your heart does. Now here's the good news. The same lifestyle changes that reverse insulin resistance are the same changes that improve erectile function. Multiple studies from the NIH, Harvard, and European Association of Urology confirm that men with early ED related to diabetes can restore function, not just with pills, but by improving blood flow, restoring nitric oxide, reducing inflammation, and increasing testosterone naturally through weight loss, exercise, improved sleep, and better insulin control. Exercise alone can improve erectile function by up to 40% because muscles act like a sponge that absorbs glucose and reduces insulin resistance. Reducing visceral fat raises testosterone. Cutting sugar and refined carbs lowers inflammation. Sleep increases nitric oxide production. Resistance training increases vascular growth. And for some men, medications like metformin, SGLT2 inhibitors, or GLP-1 agonists not only help control diabetes, they may also indirectly improve erection quality by restoring vascular health. But here's the key point. Erectile dysfunction caused by vascular damage will not fully resolve with Viagra or Cialis alone. Those pills open the vessels temporarily, but they do not repair the damage. They are symptom relief, not a cure. And if a man uses them without addressing the root cause, the sexual problem will progress because the metabolic disease is progressing. That is why I recommend every man who experiences erectile changes get 3 tests immediately: fasting glucose and A1C to assess blood sugar, fasting insulin to detect insulin resistance early, and testosterone levels to assess the hormonal impact. If the problem is vascular, metabolic, or hormonal, these tests will reveal it long before complications occur. The biggest mistake men make is assuming erection problems are normal aging. They are not. Normal aging does not cause sudden vascular failure. Normal aging does not lower nitric oxide by 70%. Normal aging does not destroy nerves. Chronic disease does. And diabetes is the #1 metabolic disease behind it. So if you are a man experiencing weaker erections, slower response, morning erections fading, reduced sensitivity, or loss of firmness, don't just reach for pills. Reach for answers. Your body is not malfunctioning randomly. It is communicating. Now let me finish with what I always tell my patients. Erectile problems are not a sign of broken masculinity. They're a sign of broken metabolism. And unlike shame, science gives you real options. Reverse insulin resistance, you improve blood flow. Improve blood flow, you restore function. Restore function, you change not just your sexual health, but your heart health, your brain health, your lifespan, your confidence, your energy, and your future. So ask yourself, is your body trying to warn you, and have you been ignoring it? If you want me to record follow-up videos explaining how to reverse insulin resistance, how nitric oxide works, how testosterone and diabetes are connected, or the best diet and exercise plan to fix ED from the inside out, let me know in the comments. I read every single one because I don't just want to treat patients. I want to educate men before they become patients. If this video helped you see the bigger picture, share it with someone who needs to understand that sexual health is whole body health. And if you haven't yet, subscribe, because I'm here to help you live longer, live stronger, and stay in control of your health, one smart decision at a time. Take care, and I'll see you in the next video.